Hello, my name is Jacqueline Hennessy, and welcome to my capstone reflection video for NUR-FXP4900. The intervention for the patient I spent time with was lifestyle modifications and non-pharmaceutical ways to manage hypertension, as well as a creation of an educational brochure. According to the 2021 Heart Disease and Stroke statistics, hypertension affects nearly 1 in 2 adults in the U.S. That's 46%, according to Davis in 2021. High blood pressure affects so many patients and individuals that I felt it was an important thing to incorporate and further my knowledge. A registered nurse that I know was diagnosed with hypertension 6 months ago and found this to be a great opportunity to help her with interventions and plan for the Capstone project. Having high blood pressure can put patients at so many risks, such as stroke, ischemic heart disease, heart failure, and is known as the leading cause of chronic kidney disease, as in Kerry 2018. Interventions were created with this nurse, and these included a plan to quit smoking, incorporate an increase of exercise every week, modify her diet towards the DASH diet. With the recent diagnosis, she's hoping to reduce her blood pressure with these lifestyle modifications to lower or eventually be taken off the hypertensive medication under the supervision of her physician. By including patients in their own care plan, it helps to improve compliance to the treatment plan and can be made just for them. When using evidence-based and peer-reviewed literature, it ensures the best practice as a registered nurse. I use the Capella Library to search databases such as CINAHL within the past 5 years for articles and journals. It is best to use literature within the past 5 years so it is up to date and best practice. Using the literature helped to find evidence-based strategies for reducing blood pressure, utilizing lifestyle changes for her hypertension. It has been associated with improved patient outcomes when nurses are trained to apply evidence-based practices, as in Chan 2020. As I mentioned before, the patient I collaborated with is a registered nurse. We had open discussions on how far technology has come in the healthcare field. We discussed ways for her to focus on utilizing such technology for herself to manage and monitor her blood pressure. She has access to a patient portal in which she can update her physician with her blood pressure as she monitors it at home. An app was also downloaded for her to help quit smoking by setting goals and following through with them. While on the medication for her blood pressure, her smartphone has daily reminders set to ensure she takes her medication on time without missing any doses. As a nurse in Florida, the Florida Nurse Practice Act states that it is there to ensure every nurse practicing in this state meets minimum requirements for safe practice. If a nurse fails to meet competency to care for patients or is a danger, that nurse should be prohibited from practicing in the state of Florida, according to 464.002 in the Nurses Practice Act. You must be trained and qualified to practice as a registered nurse. This ensures that the hypertensive patient is adequately taken care of. It helps to ensure that creating a proposed intervention will be helpful as a skilled nurse. The American Nurses Association updated provisions of the Nursing Code of Ethics, and Provision 2 highlights collaboration, the primacy of the patient's interests, professional boundaries, and conflicts of interest for nurses, in Tony, Butley, and Martin, 2022. This provision influenced the planning of the project while collaborating with the patient. The Capstone project outcomes I expected were to help this nurse so she can be healthy and maintain working without any complications from her hypertension. The nurse was very eager to make changes since this was a newer diagnosis and was very hopeful to improve it with the lifestyle changes. She has made a goal to completely quit smoking in 30 days as she feels it will be attainable. I was a little overwhelmed at the thought of the Capstone project, but once I started to do the research, I began to learn a lot more about hypertension and how to utilize lifestyle modifications when educating patients. By learning and refreshing my mind of all the possible ways patients can reduce hypertension on their own, it made me feel encouraged I could really make a difference in someone's life with educating patients. I was a little overwhelmed when starting the RN to BSN program at Capella, but it turned out to be a great experience. I had attempted to start 3 different times at a different school, and I just kept putting it on hold. I've grown so much as a writer and at researching for articles. I've gained a lot of knowledge in leadership and collaboration of care. The feedback that was given throughout the program was very helpful and encouraging. This program has genuinely benefited my personal and professional development by allowing me to obtain a deeper grasp of leadership and healthcare in general.